A phlebotomist encounters a patient with tiny, rolling veins. Which is the most effective strategy? A. Insert the needle at a steep angle. B. Anchor the vein firmly and use a butterfly needle. C. Apply the tourniquet much tighter than normal. D. Choose the dominant arm for venipuncture. Answer: B. Rolling veins are difficult because they move under the skin when punctured. Anchoring the vein with proper technique helps stabilize it, reducing the risk of multiple punctures. A butterfly needle allows for a more controlled and shallow insertion, which is ideal for fragile veins. Using a steep angle increases the chance of piercing through the vein, causing hematomas. Over-tightening the tourniquet may collapse the vein instead of stabilizing it. Choosing the dominant arm has no relevance if the vein rolls. The key principle is stabilization and using equipment suited for small, fragile veins, ensuring successful collection with minimal patient discomfort. If blood is drawn before allowing the disinfectant to fully dry, what is the primary risk? A. Faster clotting of the blood sample. B. Contamination and hemolysis of the specimen. C. Increase in platelet count reading. D. Less pain for the patient. Answer: B. When alcohol or disinfectant has not dried completely, it may contaminate the specimen and cause hemolysis, where red blood cells rupture. This leads to inaccurate test results, particularly for chemistry and hematology studies. Additionally, alcohol can sting the patient's skin when punctured, increasing discomfort. Faster clotting or platelet changes are not affected by alcohol residue. Proper drying time is crucial not only for accurate results but also to maintain patient safety and comfort. This is why phlebotomists are trained to wait at least 30 seconds or until the area is visibly dry before inserting the needle. During venipuncture, a patient reports sharp shooting pain down the arm. What should the phlebotomist do immediately? A. Continue drawing blood quickly. B. Adjust the needle slightly deeper. C. Withdraw the needle immediately. D. Ask the patient to remain still. Answer: C. A sharp shooting pain often indicates nerve involvement or injury during venipuncture. Continuing the draw could cause permanent damage to the nerve and severe pain for the patient. Adjusting the needle deeper increases the risk of more trauma. Asking the patient to remain still ignores the warning sign. Withdrawing immediately prevents further damage, then documenting the event and selecting an alternate site is the correct practice. Protecting nerves and tissues is a priority in phlebotomy. Patient safety must always outweigh the need to obtain a sample on the first attempt. Which additive prevents clotting by binding calcium? A. Sodium citrate. B. Heparin. C. Thrombin. D. Potassium oxalate. Answer: A. Sodium citrate works by binding calcium, an essential factor in the clotting cascade. Without calcium, clotting is inhibited, making citrate tubes ideal for coagulation studies such as PT and INR. Heparin works differently, by inhibiting thrombin and other clotting enzymes. Thrombin is actually a clotting activator, not an anticoagulant. Potassium oxalate also binds calcium but is less commonly used compared to citrate for precise coagulation testing. The mechanism of binding calcium is particularly important because it allows laboratories to measure clotting factors accurately without the interference of premature clotting. A blood culture is collected incorrectly after touching the puncture site post-cleaning. What is the consequence? A. Specimen clotting. B. False positive results due to contamination. C. Lower hemoglobin measurement. D. Reduced plasma volume. Answer: B. Blood cultures are highly sensitive to contamination. Touching the site after disinfecting introduces skin flora into the sample, which may grow in the culture medium. This can produce false positives, leading to unnecessary antibiotics and longer hospital stays for patients. Clotting, hemoglobin levels, or plasma volume are not directly affected by touching the site. Phlebotomists must be extremely careful to maintain a septic technique, especially in blood cultures where the accuracy of results directly influences treatment for infections like sepsis. Which vein is considered the most challenging yet preferred option in obese patients when performing venipuncture? A. Basilic vein. B. Median cubital vein. C. Cephalic vein. D. Dorsal hand vein. Answer: C. The cephalic vein is often the vein of choice in obese patients because it is more superficial and easier to palpate compared to the median cubital or basilic veins, which may be buried under excess adipose tissue. While the basilic vein is larger, it runs close to the brachial artery and median nerve, making it riskier. The cephalic vein's lateral positioning offers safer access and reduces the risk of arterial puncture. Phlebotomists must be trained to locate it accurately, as poor palpation can lead to failed attempts. Additionally, using proper anchoring techniques is critical in obese patients because veins tend to roll easily. Correct site selection is essential not only for specimen quality but also to minimize patient discomfort. If the cephalic vein cannot be located, phlebotomists may resort to hand veins, but these are more painful and prone to hemolysis. Thus, understanding vein accessibility is crucial in challenging patient populations. A phlebotomist collects blood from a patient receiving 4 fluids in both arms. Where should the blood be drawn? A. Distal to the fore site. B. Proximal to the fore site. C. Opposite arm, above fore line. D. Below the fore site, after stopping fluids. Answer: A. When a patient has 4 fluids running, blood collection must be performed distal, below, to the fore site to avoid contamination by the infused solution. Drawing proximal or above the fore increases the risk of diluted samples, leading to inaccurate results such as falsely low electrolyte levels. If both arms have IVs, the phlebotomist should request temporary suspension of 1/4 for at least 2 minutes before drawing blood distal to the site. Documentation is also crucial, as laboratory staff must know blood was collected near and fore. Using incorrect technique here can cause major diagnostic errors, particularly in patients monitored for electrolyte balance, drug levels, or glucose. Stopping the fore without physician order is never recommended for phlebotomists. Therefore, proper site selection ensures specimen accuracy while prioritizing patient safety. Which additive is most critical in preventing platelet clumping during a CBC test? A. EDTA, lavender top. B. Sodium citrate, light blue top. C. Heparin, green top. D. Serum separator, gold top. Answer: A. EDTA is the additive of choice for hematology testing because it chelates calcium, thereby preventing clot formation and platelet clumping. Without EDTA, platelet aggregates may form, resulting in falsely low platelet counts, misinterpretation of blood smears, and possible misdiagnosis of conditions like thrombocytopenia. While sodium citrate and heparin prevent clotting, they are not as effective in maintaining platelet morphology. A serum separator tube allows clotting, making it unsuitable for platelet studies. Proper inversion of the EDTA tube after collection is vital to ensure even mixing of the anticoagulant. Failure to do so may lead to clotting within the tube, rendering the sample unusable. Thus, EDTA ensures both accurate platelet counts and high-quality morphology for smear evaluation. During capillary puncture, why is the first drop of blood usually wiped away? A. It contains clotted platelets. B. It has higher oxygen content. C. It contains tissue fluid that dilutes the sample. D. It increases hemoglobin concentration. Answer: C. The first drop of blood in capillary puncture often contains tissue fluid and interstitial material released during skin puncture. If this drop is collected, it may dilute the blood sample, leading to inaccurate results such as falsely low glucose or hematocrit readings. Wiping the first drop ensures that subsequent blood is a more accurate representation of circulating blood. Some exceptions exist, such as certain neonatal screening tests, where the first drop may be retained to avoid excess tissue trauma. Using proper collection techniques like warming the site and ensuring gentle pressure also improves blood flow without excessive tissue fluid contamination. Failure to remove the first drop is one of the most common pre-analytical errors in capillary testing. This simple step helps ensure sample reliability and test validity. Which of the following complications is most associated with prolonged tourniquet application? A. Hemoconcentration. B. Hemolysis. C. Lipemia. D. Hyperglycemia. Answer A. Leaving a tourniquet in place for more than 1 minute causes hemoconcentration, where fluid shifts out of the vein and cells remain concentrated in the blood sample. This results in artificially high readings of proteins, electrolytes, and hematocrit. Hemolysis is more commonly linked to needle mishandling or vigorous tube shaking. Lipemia is related to recent food intake, not tourniquet use. Hyperglycemia is unrelated to tourniquet application. Phlebotomists must be vigilant in monitoring the time and should release the tourniquet promptly once blood flow is established. If hemoconcentration occurs, it compromises specimen accuracy, potentially leading to incorrect diagnosis or treatment. For example, falsely high potassium may suggest hyperkalemia in a healthy patient. Thus, timing of tourniquet use is essential in minimizing pre-analytical errors. What is the most serious risk when drawing blood from the basilic vein? A. Hematoma formation. B. Nerve injury. C. Arterial puncture. D. Vein collapse. Answer B. The basilic vein is risky for venipuncture because important nerves, especially the median and medial cutaneous nerves, lie very close. Accidental puncture can cause sharp pain, numbness, or even permanent nerve damage. While hematoma, arterial puncture, or vein collapse can occur, nerve injury is the most serious complication, making the basilic vein less preferred than the safer median cubital vein. What is the primary reason for selecting a vein over an artery for routine blood collection? A. Arteries have slower blood flow. B. Venous blood is less oxygenated. C. Arteries are deeper and higher pressure. D. Veins clot faster than arteries. Answer C. Arteries are deeper, pulsatile, and carry blood at higher pressure, increasing the risk of injury or hematoma if punctured. Venous blood, on the other hand, flows steadily and at lower pressure, making it safer for routine collection. Arterial punctures are reserved for blood gases, where oxygen content and pH need to be measured. Veins are more superficial, easier to palpate, and less painful for patients. Attempting venipuncture in arteries unnecessarily endangers patients and can cause complications like prolonged bleeding or nerve damage. Phlebotomists must identify vein landmarks and avoid arteries unless specifically trained for arterial sampling. Choosing veins ensures both specimen accuracy and patient safety. When performing a blood draw, the tube is overfilled. What is the main risk associated with overfilling anticoagulant tubes? A. Dilution of blood. B. Incomplete clot formation. C. Excess anticoagulant causing clotting issues. D. Hemolysis. Answer C. Overfilling tubes with anticoagulant can disrupt the optimal blood-to-additive ratio, leading to abnormal test results. For example, too much EDTA can cause excessive chelation of calcium, interfering with hematology tests or producing spurious low platelet counts. Coagulation tubes like sodium citrate are particularly sensitive. Overfilling can produce falsely shortened clotting times. Maintaining proper tube fill levels ensures that the ratio of blood to additive is within manufacturer specifications. Accurate ratios preserve sample integrity and prevent pre-analytical errors that can impact patient care. Proper technique in monitoring fill lines are critical for phlebotomy quality control. Why is it important to label the tube immediately after collection at the patient's side? A. To prevent misidentification. B. To maintain sample temperature. C. To avoid hemolysis. D. To allow time for tourniquet release. Answer A. Labeling tubes at the patient's side immediately after collection is crucial to prevent specimen misidentification, which is a leading cause of pre-analytical errors. Delaying labeling can result in switching samples, leading to incorrect test results, misdiagnosis, and inappropriate treatment. This is particularly critical in high-risk patients or those undergoing multiple tests. Proper labeling includes the patient's full name, date of birth, collection date, and phlebotomist initials. This practice ensures traceability and maintains the chain of custody for laboratory specimens. Even a small labeling error can compromise patient safety and result in significant liability for healthcare providers. In pediatric patients, why is capillary collection often preferred over venipuncture? A. Easier to perform on large veins. B. Minimizes blood volume loss. C. Less accurate than venipuncture. D. Prevents platelet aggregation. Answer B. Pediatric patients have a limited total blood volume, so capillary collection is preferred to reduce the amount of blood withdrawn. Small volume testing can be done with microtubes from heel sticks or finger pricks. Venipuncture may cause more trauma and stress, especially in neonates and infants. Proper technique is crucial to avoid hemolysis and tissue fluid contamination. Capillary collection is also faster and can be repeated more easily if multiple tests are needed. This method ensures both specimen adequacy and patient safety. Phlebotomists must be trained to use appropriate lancets and avoid excessive squeezing, which can distort results. A patient faints during venipuncture. What is the first priority? A. Finish the blood draw quickly. B. Remove the needle and lay the patient flat. C. Apply a tourniquet above the puncture site. D. Call for emergency services immediately. Answer B. Syncope, fainting, during venipuncture is common, and patient safety is the priority. The needle must be removed to prevent injury, and the patient should be laid flat with feet elevated if possible to restore blood flow to the brain. Monitoring airway, breathing, and circulation is important. Emergency services are called only if the patient does not recover promptly. Completing the draw during a syncopal episode risks needle stick injury or trauma. Phlebotomists should also provide reassurance, assess vitals, and document the incident. This protocol reduces risk of falls, ensures patient safety, and maintains professional standards. Which pre-analytical factor can falsely elevate potassium levels in a blood sample? A. Hemolysis. B. Delayed centrifugation. C. Prolonged tourniquet application. D. All of the above. Answer D. Potassium levels are highly sensitive to pre-analytical errors. Hemolysis releases intracellular potassium into plasma, artificially increasing results. Delayed centrifugation allows potassium leakage from cells. Prolonged tourniquet application causes hemoconcentration, raising analyte concentration including potassium. These errors can lead to misdiagnosis of hyperkalemia, resulting in inappropriate treatment. Phlebotomists must use gentle technique, timely processing, and correct tourniquet timing to prevent falsely elevated potassium. Awareness of pre-analytical variables ensures laboratory results are clinically accurate and patient care is not compromised. Why is it unsafe to use a vein in the antecubital fossa if the patient has an AV fistula? A. It increases clotting risk. B. It can damage the fistula. C. It reduces vein visibility. D. It causes hemolysis. Answer B. Arteriovenous (AV) fistulas are surgically created for hemodialysis and should never be used for venipuncture. Puncturing a fistula can damage the access, lead to thrombosis, and compromise dialysis treatment. Additionally, bleeding may be difficult to control due to high blood flow in the fistula. Phlebotomists must identify fistula sites and choose alternate veins. Patient safety and long-term vascular access integrity are paramount. Documenting and educating patients about avoiding puncture in fistula arms is critical. This emphasizes the importance of thorough patient assessment before venipuncture. Which tube should be filled first when performing a multi-tube venipuncture that includes a blood culture? A. Light blue top. B. Red top. C. Blood culture bottle. D. Lavender top. Answer C. Blood cultures are highly sensitive to contamination and must be collected first. Collecting them after tubes with additives increases the risk of contamination from anticoagulants or preservatives, potentially causing false positive or false negative results. Proper aseptic technique, including cleansing with alcohol and iodine, is essential. Subsequent tubes are drawn following the correct order of draw to prevent cross-contamination. Filling blood culture bottles first ensures microbial integrity, prevents diagnostic errors, and maintains accurate results critical for patient treatment, especially in suspected sepsis cases. Why must venipuncture needles be disposed of immediately in sharps containers? A. To prevent cross-contamination and needle stick injuries. B. To maintain vein integrity. C. To preserve blood sample quality. D. To comply with labeling guidelines. Answer A. Needles are biohazardous and must be discarded in approved sharps containers immediately after use. Improper disposal increases the risk of needle stick injuries, which can transmit blood-borne pathogens like HIV, HBV, and HCV. Delayed disposal can lead to accidental injuries for healthcare workers or patients. Sharps containers are puncture-resistant, clearly labeled, and kept near the collection site to ensure compliance. Immediate disposal is a key component of infection control protocols and laboratory safety standards. Proper handling protects both phlebotomists and the healthcare environment. Which type of tube is used for blood glucose testing that requires minimal glycolysis? A. Gray top with sodium fluoride. B. Lavender top with EDTA. C. Light blue top with sodium citrate. D. Green top with heparin. Answer A. Gray top tubes contain sodium fluoride, which inhibits glycolysis, preserving glucose levels during transport and processing. Without this additive, red blood cells continue metabolizing glucose, leading to falsely low results. EDTA and sodium citrate prevent clotting but do not preserve glucose. Heparin tubes are used for plasma chemistry but allow glycolysis to continue. Proper tube selection ensures accurate glucose measurement, which is crucial for diagnosing and managing diabetes or hypoglycemia. Timely processing and correct inversion are also necessary to maintain sample integrity. A phlebotomist notices the patient's arm is swollen, warm, and red near the previous puncture site. What is the likely complication? A. Hematoma. B. Thrombophlebitis. C. Nerve injury. D. Vein collapse. Answer B. Thrombophlebitis is inflammation of a vein with clot formation, often appearing as swelling, redness, warmth, and tenderness. It can occur after venipuncture, especially if veins are repeatedly accessed or if sterile technique is not maintained. Hematomas are usually bluish and caused by extravasation of blood, not inflammation. Nerve injury would cause pain, tingling, or numbness. Vein collapse occurs when fragile veins are punctured multiple times. Phlebotomists must avoid affected sites and report signs to the nurse or physician. proper site selection, minimal punctures, and aseptic technique reduce the risk of thrombophlebitis. Which practice minimizes hemolysis during venipuncture? A. Vigorous mixing of tubes. B. Using a small gauge needle for high-flow veins. C. Promptly transferring blood between tubes. D. Smooth, gentle inversion and correct needle size. Answer: D. Hemolysis occurs when red blood cells rupture, which can falsely elevate potassium, LDH, and AST levels. Using the correct needle size prevents excessive shear forces on the cells. Gentle inversion ensures proper mixing of blood with additives without causing turbulence that ruptures cells. Vigorous shaking, transferring blood forcefully, or using overly small needles increases hemolysis risk. Minimizing hemolysis is critical for accurate chemistry and hematology testing. Patient safety and sample integrity rely on proper technique. Phlebotomists must consistently apply gentle handling throughout collection and processing. Why should a phlebotomist avoid drawing blood from the arm with a mastectomy on the same side? A. Higher risk of infection and lymphedema. B. Veins are deeper and inaccessible. C. Clotting is faster. D. Blood is more acidic. Answer: A. Patients with a history of mastectomy may have lymph node removal, which increases the risk of lymphedema if venipuncture is performed on that arm. Trauma can cause swelling, pain, and possible infection. Veins may also be fragile or scarred. Drawing from the opposite arm reduces risk and protects patient comfort and health. Phlebotomists must always inquire about mastectomy history during assessment. Following proper precautions maintains safety, prevents complications, and aligns with best practices for post-surgical patients. What is the main reason for using a butterfly needle in venipuncture? A. High-volume blood collection. B. Small or fragile veins. C. Reducing clotting. D. Avoiding hemoconcentration. Answer: B. Butterfly needles are ideal for patients with small, rolling, or fragile veins, such as pediatric or elderly patients. The short, flexible tubing allows more control and reduces vein trauma. High-volume collections are better done with straight needles. Using a butterfly needle minimizes hematomas and patient discomfort. Correct technique includes anchoring the vein, gentle insertion, and slow blood flow. Proper selection ensures specimen quality while maintaining patient safety. Butterfly needles also reduce the risk of vein collapse compared to rigid needles in fragile veins. Why is it essential to invert additive tubes immediately after collection? A. To activate clotting. B. To prevent additive settling and ensure proper mixing. C. To increase blood flow. D. To enhance centrifugation speed. Answer: B. Additive tubes, such as EDTA, sodium citrate, or heparin, must be inverted gently to mix blood with the anticoagulant. Failure to invert may result in clot formation or uneven additive distribution, compromising test accuracy. Clotting may lead to sample rejection, repeated draws, and delayed patient care. Inversion ensures a homogeneous sample for hematology or coagulation analysis. Vigorous shaking must be avoided to prevent hemolysis. Proper handling immediately after collection maintains specimen integrity and reduces pre-analytical errors. A patient's sample is lipemic. What is a common cause? A. Recent fatty meal. B. Hemolysis. C. Prolonged tourniquet use. D. For contamination. Answer: A. Lipemia, the presence of high lipid content in blood, is often caused by recent ingestion of fatty foods. It can interfere with photometric or enzymatic laboratory assays, producing inaccurate results for glucose, electrolytes, and liver function tests. Fasting samples are recommended for certain tests to prevent lipemic interference. Hemolysis or tourniquet issues do not produce lipemia, and 4. Contamination affects other parameters. Proper patient preparation and timing of blood collection are essential to avoid lipemia and ensure accurate laboratory measurements. Which step is most important before drawing blood from a patient with an allergy to latex gloves? A. Use alcohol-based gloves. B. Use non-latex gloves and verify patient history. C. Apply double tourniquets. D. Use smaller gauge needles. Answer: B. Latex allergies can cause serious reactions including rash, itching, or anaphylaxis. Using non-latex gloves, such as nitrile or vinyl, prevents exposure. Phlebotomists must confirm the allergy during patient assessment. Alcohol-based gloves do not prevent latex contact. Correct needle size is unrelated to latex exposure. Verifying patient history, documenting it, and selecting proper protective equipment are critical for safety. This prevents medical emergencies and ensures patient trust. Non-latex alternatives are widely available and standard in allergy protocols. Why is it inappropriate to use the first drop of blood in a capillary glucose test? A. It may be contaminated with tissue fluid. B. It has less hemoglobin. C. It clots faster. D. It is more acidic. Answer: A. The first drop of blood from a capillary puncture may contain interstitial or tissue fluid, which can dilute the sample. Collecting this drop can produce falsely low glucose readings or other analyte concentrations. Wiping it away ensures that subsequent drops are representative of circulating blood. Proper technique includes gentle pressure, avoiding excessive squeezing, and ensuring consistent sample volume. Accurate capillary sampling is essential for reliable glucose monitoring, especially in diabetic or neonatal patients. Phlebotomists must adhere to this protocol to maintain test integrity. Which factor is most critical in preventing post-venipuncture hematoma formation? A. Using large needles. B. Applying pressure after needle withdrawal. C. Filling tubes too quickly. D. Performing venipuncture at a 45-degree angle. Answer: B. Applying firm pressure immediately after removing the needle compresses the puncture site, allowing blood to clot within the vein and preventing leakage into surrounding tissue. Failure to apply adequate pressure can result in hematoma formation, pain, swelling, and bruising. Needle size, tube fill speed, and insertion angle contribute, but pressure is the most controllable factor post-collection. Patients should be advised to maintain pressure for several minutes. Proper technique preserves patient comfort, minimizes complications, and reduces liability for the phlebotomist. Hematoma prevention is essential for high-quality venipuncture practice. Which vein should be avoided if a patient has a hematoma at the antecubital site? A. Median cubital vein. B. Cephalic vein. C. Basilic vein. D. Any vein near the hematoma. Answer: D. Drawing from a site near a hematoma can exacerbate bleeding, increase bruising, and produce inaccurate results due to tissue fluid contamination. Hematomas indicate vessel trauma or leakage, so phlebotomists must choose a distant vein. Using proper site assessment minimizes patient discomfort and prevents complications. Documenting the presence of a hematoma ensures laboratory personnel are aware of potential sample issues. Selecting an alternate site maintains specimen integrity, avoids further trauma, and ensures accurate laboratory analysis. Avoiding compromised veins is a fundamental aspect of patient safety in phlebotomy. What is the primary reason to avoid drawing blood from a patient's arm with N4 infusion? A. It is more painful. B. For fluids can dilute the blood sample. C. Veins are less visible. D. Risk of vein collapse. Answer: B. Blood drawn proximal to N4 line may contain 4 fluids, leading to falsely low analyte concentrations, including electrolytes, glucose, or medication levels. Collecting distal to the 4, or temporarily stopping the infusion if possible, ensures sample accuracy. This is especially critical for tests requiring precise concentrations, such as therapeutic drug monitoring. Failure to account for 4 fluids may result in misdiagnosis or inappropriate treatment. Proper site selection and communication with nursing staff are essential. This highlights the phlebotomist's role in pre-analytical quality control. Which tube color is specifically used for coagulation studies like PT and INR? A. Lavender. B. Light blue. C. Green. D. Gray. Answer: B. Light blue top tubes contain sodium citrate, which binds calcium to prevent clotting temporarily, making them ideal for coagulation testing. The blood-to-additive ratio must be precise. Underfilling or overfilling affects results. Lavender tubes, EDTA, are used for hematology, green for plasma chemistry, and gray for glucose preservation. Proper tube selection ensures accurate coagulation measurements, which is critical for patients on anticoagulants. Phlebotomists must follow the order of draw to prevent cross-contamination from other additives. Proper technique ensures reliable diagnostic results and guides safe patient care. A patient has small, fragile veins prone to collapse. Which needle gauge is most appropriate? A. 16 gauge. B. 18 gauge. C. 21 gauge. D. 23 gauge butterfly. Answer: D. Small, fragile veins are best accessed using a 23 gauge butterfly needle. The flexibility and smaller diameter reduce vein trauma and the risk of collapse. Larger needles, 16 to 21 gauge, are suitable for high-volume collections but increase hematoma risk in fragile veins. Butterfly needles allow better control, slower flow, and gentle collection. Proper technique includes anchoring the vein, minimal tourniquet time, and careful inversion of tubes. Using the correct equipment ensures patient comfort and specimen quality, reducing repeat draws. Training phlebotomists to recognize fragile veins is crucial for safe practice. Which action can prevent hemolysis during sample handling? A. Vigorous shaking of tubes. B. Rapid transfer between tubes. C. Gentle inversion after collection. D. Using a high-speed centrifuge immediately. Answer: C. Gentle inversion mixes the blood with anticoagulants without rupturing red blood cells. Hemolysis can falsely elevate potassium, LDH, AST, and other analytes, compromising test accuracy. Vigorous shaking, rapid transfers, or improper centrifugation increase hemolysis risk. Proper phlebotomy technique minimizes pre-analytical errors. Careful handling ensures specimen integrity, reduces the need for recollection, and protects patient comfort. Phlebotomists must follow manufacturer guidelines for inversion counts specific to tube type. Attention to detail preserves both clinical reliability and laboratory workflow efficiency. During a multi-tube draw, the red top serum tube must be collected after which tube type to prevent contamination? A. Light blue, sodium citrate. B. Lavender, EDTA. C. Gray, sodium fluoride. D. Green, heparin. Answer: A. Red top serum tubes contain no additives and should be collected after coagulation tubes like light blue. Drawing serum before anticoagulant tubes avoids contamination that may interfere with lab testing. Collecting in the correct order of draw prevents additive carryover, cross-contamination, and inaccurate results. Adhering to the order of draw is a critical pre-analytical control measure. Proper sequencing maintains sample integrity and ensures reliable testing outcomes. Phlebotomists must understand each tube's role and additive to comply with best practices. What is the most common cause of a failed venipuncture on the first attempt? A. Improper needle angle or depth. B. Use of a small gauge needle. C. Slow blood flow. D. Overfilled tube. Answer A. The most frequent cause of a failed venipuncture is incorrect needle angle or insertion depth. Too shallow may miss the vein, too deep may puncture through. Slow blood flow can result from vein size or positioning but is not usually the primary cause. Needle gauge affects flow but not failure rate if technique is correct. Overfilled tubes affect sample ratio, not venipuncture success. Phlebotomists must assess vein depth, anchor properly, and maintain the correct angle, 15 to 30 degrees, for successful first attempts. Proper technique reduces patient discomfort, hematoma risk, and repeat draws. A patient's blood sample is labeled incorrectly. Which type of error is this? A. Analytical. B. Pre-analytical. C. Post-analytical. D. Instrumental. Answer B. Mislabeling a specimen is a pre-analytical error because it occurs before laboratory testing. Pre-analytical errors also include patient misidentification, wrong tube selection, or improper collection. Analytical errors occur during testing, and post-analytical errors occur during result reporting. Pre-analytical errors are the most common cause of lab mistakes. Proper labeling at the patient's side ensures specimen traceability, patient safety, and accurate diagnosis. Phlebotomists play a vital role in reducing pre-analytical errors through diligence and protocol adherence. Which complication can occur if the tourniquet is applied too tightly or for too long? A. Hypoglycemia. B. Lipemia. C. Hemolysis. D. Hemoconcentration. Answer D. Prolonged or overly tight tourniquet application causes fluid to shift from plasma into tissues, concentrating cells and analytes in the remaining blood. This hemoconcentration can falsely elevate potassium, protein, calcium, and hematocrit readings. Hemolysis is more associated with handling errors, and lipemia or hypoglycemia are unrelated. Tourniquet time should be limited to under 1 minute to prevent pre-analytical errors. Proper timing ensures accurate test results and minimizes patient discomfort. Phlebotomists must monitor tourniquet placement carefully. Why is it critical to assess patient history before venipuncture? A. To select proper tube additives. B. To identify potential complications like fainting or bleeding disorders. C. To determine needle gauge. D. To avoid hemolysis. Answer B. Patient history identifies risks such as syncope, hematomas, anticoagulant therapy, or AV fistulas. Assessing history helps phlebotomists select a safe site, needle size, and technique. Ignoring patient history increases risk of complications and sample rejection. Proper assessment allows preparation for emergencies and enhances patient comfort. It also ensures legal compliance and professional accountability. Phlebotomists must ask about allergies, prior reactions, or chronic conditions before proceeding. Knowledge of history is essential for safe and effective specimen collection.